discuss a molecule that has generated immense interest in the longevity community, metformin. This is not some exotic new compound. It's one of the most widely prescribed drugs in the world, used for decades as a first-line treatment for type 2 diabetes. Its primary function in that context is to lower blood glucose levels, primarily by reducing glucose production in the liver and improving insulin sensitivity in peripheral tissues. But over the years, observational studies began to reveal something intriguing. Diabetic patients taking metformin seem to have lower rates of cancer and cardiovascular disease, and in some cases even lived longer than non-diabetic individuals. This sparked the question, could metformin be acting on fundamental aging pathways independent of its effects on glucose? The evidence suggests yes. The mechanisms are multifaceted. One of the key ways metformin works is by mildly inhibiting complex 1 of the mitochondrial electron transport chain. This creates a slight energy deficit within the cell, which, much like caloric restriction, activates the AMPK energy sensing pathway. As we just discussed, activating AMPK initiates a cascade of downstream effects, including enhanced autophagy and reduced inflammation, which are central to promoting cellular health and resilience. Furthermore, metformin appears to directly impact inflammation. It's been shown to reduce the production of pro-inflammatory cytokines, such as TNF-alpha and IL-6, which are known to increase with age and contribute to a state of chronic, low-grade inflammation often called inflammaging. It also reduces oxidative stress by decreasing the production of reactive oxygen species, or ROS, which are damaging byproducts of metabolism. By improving insulin sensitivity, reducing inflammation, and mitigating oxidative stress, metformin targets 3 of the core hallmarks of aging simultaneously. The promise of metformin as a geroprotector, a substance that protects against aging, is so significant that it has led to a landmark clinical trial. The TAME trial, which stands for Targeting Aging with Metformin, is the first of its kind. Its goal is not to treat a specific disease, but to test whether metformin can delay the onset of a composite of age-related diseases, cancer, cardiovascular events, cognitive decline, and death in thousands of non-diabetic older adults. This is a paradigm-shifting trial because it seeks to get aging itself recognized as a treatable condition by regulatory bodies like the FDA. If the TAME trial is successful, it could fundamentally change medicine, opening the door for other geroprotective drugs to be developed and approved for the indication of aging. It's important to note, however, that metformin is a prescription drug and can have side effects, most commonly gastrointestinal issues, and rarely a more serious condition called lactic acidosis. It can also interfere with the absorption of vitamin B12. Therefore, its use should only be considered under the guidance of a qualified healthcare professional who can weigh the potential benefits against the risks for an individual.